that, guys? Well, if you take a peek at the calendar, obviously it's October. And what is October? Well, October happens to be National Depression in Health Screening Month, a time where we as a community focus on mental health. Obviously, this is something that we need to have a larger discussion surrounding, and that's why I'm so glad I have my next guest. I'm referring to Dr. Renee Exelbert, kind enough to join us right here on the Live Zone. Ma'am, truly a pleasure to meet you. Thank you so much for coming on the show.
Happy to be here.
And so you heard me touch on it. Obviously, it's not, I would say, an easy discussion to have, but it's something that we really need to talk about, and that is depression, something so many folks suffer from, but, well, they really haven't come to the forefront to make us aware.
Absolutely. You know, I think about depression on a continuum, and that's how I describe it to my patients, that every one of us as a human being can identify what it feels like to be depressed, to withdraw, to have poor motivation, some sadness. But we're on a continuum, and what determines where we move on that continuum is really biopsychosocial factors, and that's our biology, our genetics, psychological factors in terms of how we cope, how we think about things, and social factors, what we're exposed to in the world, what we're exposed to in our family history. And so all of us are capable of experiencing a diagnostically, clinically significant depression, but it really determines, it's really determined by the severity and the frequency if we are going to get a clinical diagnosis of depression.
And so with that being said, at what point should one recognize that perhaps they have a problem? I mean, obviously, I would expect maybe changes in the sleep, your pattern of sleeping, you're not eating as much, your mood. But at what point should you say, you know what, I think I need some help?
Absolutely. The clinical diagnostic criteria is 2 weeks or more of feeling this persistent sense of sadness, lack of motivation. We want to look for eating changes, changes in our sleep. And so when somebody is really experiencing those things, sometimes they can't even get out of bed. We definitely want them to start thinking about speaking to somebody. There's another type of depression. It's called a persistent depressive disorder. And that's like more of a chronic depression. And sometimes people don't even know they're depressed because it feels like it's a part of their personality. And that type of depression is when somebody walks through life, they describe more days than not feeling sad and blue. And many patients have described to me this feeling of like being disconnected, feeling like the lights are dim. And so whenever you're feeling that level of sadness, it's really important to reach out to somebody.
We should also make mention, and this happens to be quite shocking to me, but women are twice as likely than men to suffer from depression. Yet again, concerning.
They are, you know, that's often due to hormonal changes, the many roles that they have to take in terms of housework and childbearing. You know, we also see marginalized groups having an increased level of depression, such as LGBTQ.
And so let's talk about this whole Gen Z aspect. You know, I do so many stories here on this show, and I feel like so many times Gen Zers catch a bad rap. And in this case, we're talking about the number of Gen Zers that actually suffer from depression. Yet again, something we need to have a discussion about.
Yeah, you know, the Surgeon General declared this loneliness epidemic, and 61% of Gen Zs have identified this feeling of persistent sadness and loneliness. Not only that, but we have 42% of current high school students also indicating that they feel this persistent sense of loneliness. 57% of adolescent girls in particular are feeling this sense of sadness and despair, and 25% of them are going on to formulate a suicide plan. So it's really frightening. And when we look at some correlates of that, we want to think about in 2007, the advent of social media. We have seen a skyrocketing of depression since 2007, and that's, you know, part and parcel with what we're seeing with Gen Z and depression.
Yeah, gosh, you know, this whole social media thing, I tell you, a lot of good to it, but a lot of bad as well, and something that we need to continue to keep a close eye on. Dr. Exelbert, before we wrap, obviously you heard me make mention of when should I realize that perhaps I'm suffering from depression, but what if you happen to be a friend of someone that you think is suffering from depression? How do I take that approach without offending that person?
Yeah, I think that it's always really important to just let people know that we care about them. And one of the things that we often see is, you know, people who have attempted suicide or are thinking about suicide, many of them appear happy on social media, right? And so sometimes it's really important to think about not what you're seeing on the outside, even though we can often see somebody who's depressed looking, you know, slumped over in their physical appearance or appearing withdrawn. Sometimes people who are depressed don't show those signs. And so it's always important to check in on everybody, let them know that you're thinking about them. And, even when you're nagging and annoying, also we really want to think about food and nutrition, exercise. And so if you ever notice somebody's not feeling great, show up with them at the gym. Show up with them with healthy food, because this idea of processed foods and depression, we also really want to think about that. And so we want to be there for our friends, and if they can't engage in those things on their own, we want to show up and help them do those right things that are going to move them towards a positive place.
Well, one thing's for sure, you were here for us with regard to providing some vital information. Once again, Dr. Renee Exelberg joining us right here on the Live Zone. Truly appreciate your time, ma'am.
Thank you.
You're welcome. All right, guys. On the flip side of this break, how about we talk a little Lion Lunch Hour recap? Aaron Como joins us next, right here on the Live Zone.
A truck nearly ended my life. The trucking company blamed me. So I called Mike Slocum.
Trucking companies have endless resources to fight claims. Believe me when I say, you can't face them alone. But taking on trucking companies, that's what I do.
I didn't know what to do, but Mike did.